Okay, this exercise is called the Cook hip lift. Basically what you're going to do is you're going to take a tennis ball, put it right underneath your last rib, take your leg and your hip, just grab on the tennis ball right there and put your fingers around your knee. You're not really going to crank up on your knee or anything. This is basically somewhere to just put your hands. You want to relax the whole upper body, place this knee out, or this foot out about this far, and you just want to bridge up your pelvis. Just go ahead, bridge up your pelvis. Hold for 5 seconds, and then come down. Where you're going to feel this is, you're going to feel it in the glutes on this side. We're working this side right now. You're going to feel some possible hamstring cramping. A lot of people do have this because when they have back pain, they have hamstring tightness as well. If you want to eliminate that while you're doing these, you slide this foot out a little further, and you do it again. It should alleviate some of the hamstring cramping. That looks good. Okay, go ahead and come down. The reason why you have the tennis ball there and the hip is up like this is going to limit the amount of lumbar extension that you get. A lot of people can they can't differentiate between lumbar extension and hip extension, and that's where the root of low back pain comes in. You want to be able to get about 15 degrees hip extension. Right now you're getting about neutral, and that's perfect. So this is going to limit the amount of lumbar extension, and you're going to get purely hip extension, and that's the motion the glute does the most. The hip extension movement pattern, usually it's the glute works first, then the hamstrings, then the low back. A lot of times with back pain, if the glutes aren't working, the other things compensate and they cause problems. This exercise, and combined with a couple others that I recommend for low back pain, in addition to active release technique and stretching, usually fares pretty well for solving problems like low back pain, hip pain, sciatica, pain all the way down to the leg. So you're going to want to do this one time a day, if not two, for sets of 10 to 12 on both sides.